Fanconi anemia is the first and only hereditary cancer syndrome that predisposes to oral cancer. Oral cancer is 500 to 700 times higher in Fanconi anemia patients than the general population and occurs at a young age. However, the molecular features of oral cancer from Fanconi anemia patients are not significantly different from sporadic oral cancer. Detecting oral cancer in its very earliest stages to intervene and prevent its progression to full-blown malignancy remains to be the best curative option for Fanconi anemia patients. The objective of this study is to develop a non-invasive brush biopsy test as an alternative for scalpel biopsy for the surveillance and early diagnosis of potentially malignant oral lesions in Fanconi anemia patients. Brush biopsy is a non-invasive technique that can be used to sample multiple intraoral sites with minimal discomfort to the patient. Brush biopsy can be performed more frequently than scalpel biopsy. Therefore, it is an attractive option for long-term surveillance of persistent and multifocal pre-neoplastic oral mucosal lesions in Fanconi anemia patients. The cytobrush used in the study is specifically designed to obtain a complete transepithelial cell sample, which is critical for detection of oral precancers. A programmable Bio-Nano-Chip based assay is used to detect precancerous and cancerous cells in the brush biopsy samples. A computerized digital image analysis program evaluates a combination of molecular and cytomorphometric features of the cellular samples, which are characteristic for dysplasia and carcinoma of the oral epithelium. For each patient, brush biopsy samples will be obtained from the lesion, red or white patch, and adjacent or contralateral normal mucosa. Additional brush samples can be taken if the patient has more than one intraoral lesion. The cytobrush is for one use only, and a fresh brush and vial must be used for each sampling site. Patients who agree to participate in the study will receive a brush biopsy kit, which contains the following supplies: study booklet, Orsilex brushes, labels, sample vials, and a sample vials container.
Please ask the patient to read and sign the informed consent form in the study booklet. Please ask the patient to rinse their mouth before the brush biopsy sampling. Brush samplings are done without local anesthesia or after the application of a topical anesthetic. Gel if the lesion is red or ulcerated or painful. Place the tip of the cytobrush perpendicular onto the mucosa to be sampled. Press firmly against the mucosa so that it makes firm contact and displaces the mucosa. Rotate the brush through 15 complete turns for each site to be sampled. Ask the patient to raise their hand if they want to stop the sampling due to discomfort or pain. Remove the brush head from the handle and place the brush head into the sample vials and discard the handle. Place the lesion sample into the red cap vial and non-lesion sample into the white cap vial. Seal the sample vial firmly with the lid. Mail the study booklet and sample vials to our laboratory using the prepaid FedEx mailer provided with the kit.